Stand up for a moment. Go ahead, I'll wait right here. Did you notice how your legs, your balance, and even your heart rate responded to this very simple action? It's amazing, isn't it? Most people go through their days without ever stopping to think about how the everyday foods they eat quietly influence their blood pressure levels. Surprisingly, one of the biggest culprits is probably sitting in your kitchen cabinet or fridge right now, something you consume regularly without giving it a second thought. I'm a doctor, and for more than 20 years, I've helped thousands of adults, especially those over the age of 60, who were deeply frustrated by stubborn, hard-to-control blood pressure readings. These were people who were already doing many of the right things. They walked regularly, they took their prescribed medications faithfully, and they avoided the obvious junk foods everyone warns about. Yet, despite all that effort, their numbers just kept climbing higher and higher. High blood pressure doesn't usually show up out of nowhere overnight. Instead, it builds up slowly and gradually, driven by small, everyday foods that quietly sneak their way into your daily routine. These foods feel completely harmless at the time. They don't cause any immediate or obvious symptoms, but over weeks, months, and years, they steadily push your blood pressure readings upward. Over the course of the next 23 minutes, I'm going to walk you through my 5-step FRESH protocol. This simple, practical approach is specifically designed to help you take back control of your blood pressure. The protocol draws strong support from respected research coming out of the American Heart Association, Harvard Medical School, and various other peer-reviewed studies published in top medical journals. To make this even more relevant to you personally, please drop your age in the comments below. Your age plays a big role in how your body responds to these everyday foods. By the time we reach the end of this discussion, you'll have a clear understanding of which hidden foods might be raising your blood pressure right now, why these foods tend to affect adults over 60 in a more pronounced way, and, most importantly, some realistic, practical steps you can take to reduce their negative impact without having to completely give up the foods you truly enjoy. Let's start with one of the most common hidden culprits: sodium. Think about sodium and water retention in a very straightforward way, like a garden hose. Picture your arteries as flexible tubes and your blood flowing through them just like water moves through that hose. When you take in too much salt, your body holds onto extra water in an effort to dilute the sodium concentration. That extra water increases the pressure inside those hose arteries. Over time, this ongoing pressure begins to damage the delicate walls of your arteries and causes them to become stiffer and less flexible. Sodium also signals to your kidneys to retain more water, which directly raises your overall blood volume and puts even more strain on the system. Harvard researchers conducted a careful study, tracking 1,200 adults across 5 full years. They discovered that individuals who consumed more than 2,300 milliliters of sodium each day faced a 38% higher risk of developing hypertension when compared to those who kept their intake under 1,500 milliliters daily. A lot of people say to themselves, "Oh, I don't eat that much salt. I hardly add any to my food." But the truth is, sodium hides in so many places. Processed meats like deli slices and bacon, canned soups, ready-made sauces, condiments, and even everyday salad dressings. Each individual serving might not seem like much on its own, but when you add them up across the day and the week, the total quietly piles up higher than you realize. If you've ever noticed swelling around your ankles or unexpected spikes when you check your blood pressure at home, sodium could very well be playing a major role. If this description sounds all too familiar to you, please drop the word sodium in the comments section. Now, it's important to understand that not every food that raises blood pressure is necessarily loaded with salt. Another major group to watch is refined carbohydrates. Things like white bread, pastries, cakes, cookies, and sugary soft drinks. These act like sugar bombs when they hit your system. They cause a rapid spike in your blood sugar levels, which in turn triggers a big release of insulin. Over the long term, chronically elevated insulin levels contribute to stiffening of the arteries and promote fluid retention in the body, both of which push blood pressure higher. Researchers at Johns Hopkins followed 850 adults for a full 10 years and found something striking. Those who consumed the highest amounts of refined carbohydrates ended up with 52% greater arterial stiffness compared to the people who focused mainly on whole grains. As we get older, something called the endothelium, the thin inner lining of our arteries, naturally loses a lot of its elasticity. It's similar to how a rubber band gets brittle and less stretchy with age and use. When your arteries are less flexible, even modest increases in blood volume or temporary sugar stress can cause noticeable rises in blood pressure. Adults over the age of 60 typically experience a 30–40% reduction in endothelial function compared to younger people. When you combine that natural age-related change with extra sodium or excess refined carbs and sugars, your blood vessels simply have a much harder time coping with the load. Other often overlooked items that add to the problem include store-bought salad dressings, pickled foods, many frozen dinners, and even some types of cheese. These items frequently combine high sodium, added sugars, and unhealthy fats all in one package. Individually, each one might feel minor and insignificant, but when they accumulate day after day, it's like having small pebbles in your shoes. You don't notice them at first, but eventually they make every step uncomfortable. UCLA researchers looked at 600 older adults and discovered that those who ate 2 to 3 servings of processed foods every single day had systolic blood pressure levels that were 25% higher than the group who stuck mostly to fresh, minimally processed meals. The important takeaway here is that your body isn't suddenly failing you. Instead, these small daily habits are quietly building cumulative pressure over a long period of time. The very first and most powerful step is simply becoming aware of them. Take a moment right now and ask yourself, how many of these types of foods show up in your daily routine without you really noticing? Drop your honest guess in the comments below. Let me share a couple of real examples to illustrate this point. Take Mary, who was 68 years old. She genuinely believed she was eating in a healthy way. She walked every day, she completely avoided alcohol, and she stayed away from obvious junk food. Yet her blood pressure readings stubbornly stayed around 145/90 most of the time. When we carefully reviewed her typical daily diet together, we spotted a few subtle things. 2 tablespoons of creamy salad dressing on her lunch salad, a frozen meal 3 times each week, and a small serving of pickles almost every day. Each of those choices felt completely harmless on its own, but together they were quietly driving her numbers up. After following the fresh protocol for just 4 weeks, Mary's blood pressure came down to a much healthier 124/78. Her ankle swelling noticeably decreased, and she reported feeling lighter, more energetic, and overall much better. Then there was James, age 72, who really enjoyed his sandwiches. Even though he was diligent about his medication and kept up with regular walking, his readings were creeping toward 150/88. The hidden culprits in his case included daily fruit juice, packaged crackers as a snack, and the occasional frozen dinner. After 6 weeks of applying the same fresh protocol, his blood pressure dropped to 128/76. He told me he felt truly empowered for the first time in years because he had learned how to read labels more carefully, practice better portion control, and make smart, simple swaps. These real-life stories highlight one of the most important principles. Small, consistent adjustments really can lead to measurable, meaningful improvements, even after many years of frustration and struggle. The fresh protocol is built around 5 clear, manageable steps. First is habitual awareness. This means deliberately tracking your meals, your snacks, and your beverages for a while. You start noticing patterns and identifying which foods are quietly elevating your blood pressure. Interestingly, just building this awareness often sparks positive changes all by itself. Second is mindful portion control. Even foods that are generally considered healthy can overload your system if portions get out of hand. A helpful tool here is the simple plate method. Fill half your plate with vegetables, 1/4 with lean protein, and 1/4 with complex carbohydrates. In one UCLA study, participants who practiced mindful portion control saw their systolic blood pressure drop by an average of 7 mmHg in only a single month. Third is hydration and heart-friendly drinks. This step involves swapping out fruit juices, sweet teas, and flavored waters for plain water, unsweetened herbal teas, or naturally infused water with slices of lemon, cucumber, or fresh berries. Staying consistently well hydrated helps reduce those fluid shifts that put extra stress on your blood vessels and kidneys. Fourth is reducing refined carbohydrates and added sugars. Here you replace white bread, pastries, and sweetened drinks with whole grains, fresh berries, and legumes. Pairing any carbs you do eat with protein or fiber helps slow down how quickly they absorb into your bloodstream. Harvard researchers showed that when people substituted just 2 servings of refined carbs with whole grains each day, their systolic blood pressure decreased by an average of 6 mmHg over a 12-week period. Fifth is sodium awareness. This means making a conscious effort to choose fresh ingredients whenever possible and flavoring your food with herbs, citrus, spices, garlic, or other natural options instead of relying on pre-made sauces and seasoning mixes. The American Heart Association specifically recommends keeping sodium under 1/500 milliliters per day for most older adults, but unfortunately many people unknowingly go well over 3,000 milliliters daily. The good news is that these subtle changes often start showing results quite quickly. During the very first week, many people notice reduced bloating, a mild decrease in ankle swelling, and a much sharper awareness of where hidden sodium is hiding in their diet. By the second week, blood pressure often begins trending downward, and meals start feeling more satisfying and balanced. In weeks 3 and 4, the improvements become more measurable. Systolic readings frequently drop by 5 to 10 mmHg, and people report noticeably higher energy levels throughout the day. Over the longer term, your arteries can gradually regain some of their natural flexibility, your heart doesn't have to work quite as hard, and these healthy habits become easier and more sustainable. Please remember that this protocol is not intended as a medical cure or replacement for treatment. You should never stop taking any prescribed medications without first getting approval from your doctor. If you have conditions like kidney disease, heart failure, or diabetes, it's especially important to consult your physician before making significant changes to sodium intake or fluid balance. Always aim for gradual change rather than trying to do everything at once. That helps prevent burnout and makes the adjustments stick. Focus on just one habit at a time. You can also adjust your home environment to support success. Keep healthy snacks like fresh fruit, cut vegetables, and unsalted nuts out in plain sight while moving high sodium and high sugar items out of easy reach. Practice mindful eating by turning off distractions like TV or phones, really noticing the flavors and textures of your food, and paying close attention to portion sizes. Proper hydration does more than just quench thirst. It supports healthy kidney function, helps maintain proper electrolyte balance, and can even improve how well your medications work. Stress management is another key piece. Even taking just 5 minutes twice a day for deep breathing exercises, gentle stretching, or a short walk can lower stress hormones and ease the strain on your arteries. Tracking your progress with a reliable home blood pressure monitor provides valuable real-time feedback. It lets you clearly see which specific habits are making the biggest positive difference for you. Social situations and eating out can present challenges, but a little planning goes a long way. Check restaurant menus ahead of time if possible. Request that sauces or dressings be served on the side, and try to plan lighter meals earlier in the day to balance things out. Bringing family members or caregivers into the process can provide extra support and encouragement. Regular moderate exercise, things like walking, chair yoga, or gentle resistance training helps improve circulation, reduces arterial stiffness, and strengthens your heart muscle. Remember, consistency is far more important than intensity when it comes to long-term benefits. These healthy habits also tend to make your prescribed medications work more effectively, creating a positive synergy between diet and treatment. I recommend setting aside just 5 minutes every Sunday to review your meals, beverages, snacks, and activities from the past week. Jot down notes about which habits seem to help lower your blood pressure and which ones acted as hidden triggers. Some of the most commonly overlooked foods include processed meats, canned soups, store-bought salad dressings, frozen dinners, pickled foods, refined carbohydrates, sugary drinks, many cheeses, alcohol, and typical restaurant meals. Pay special attention to the ones that appear most often in your own routine. Small, consistent adjustments really do create a powerful ripple effect. Your arteries will thank you for it over time. Sharing your goals with a trusted friend or family member adds a layer of accountability, and taking time to celebrate even small victories helps reinforce the positive changes. In the end, every single meal, snack, and beverage you choose either adds a bit of strain to your system or helps ease it. Making consistent, heart-friendly choices helps restore natural balance, improves arterial flexibility, stabilizes blood pressure, and often brings a welcome boost in daily energy. Even modest, repeated changes can produce measurable improvements in just weeks rather than waiting years for results. Don't forget that sleep quality and effective stress management are critical factors too. Chronic stress and poor sleep can raise blood pressure all on their own, separate from dietary influences. Mindful eating combined with steady, gradual adjustments leads to lasting improvements without ever feeling overly restrictive or punishing. Pick just one element of the fresh protocol to start with, whether that's improving hydration, making one smart dietary swap, or practicing more mindful eating, and commit to it consistently. Keep tracking your meals, beverages, and blood pressure readings. At the end of 30 days, take time to review your progress, celebrate whatever improvements you see, and then thoughtfully layer in the next habit. Your heart and arteries have faithfully carried you through many decades of life. Small, consistent changes, not perfection, are what allow your body to recover, regain flexibility, and achieve more stable blood pressure levels. Your body remains far more adaptable than most people give it credit for, even well after age 60. Stand up once more. Notice again how your legs feel, how your balance adjusts, and how your heart rate responds. Most people never pause to consider the quiet but powerful impact that daily foods have on blood pressure. One major culprit could be sitting right there in your kitchen. Awareness, followed by consistent action and real commitment, truly can lead to measurable improvements, even after years of feeling stuck and frustrated. Spend those 5 minutes every Sunday reviewing your meals, beverages, snacks, and activities. Focus especially on the items you consume most frequently. Sharing your goals with a friend builds accountability, and celebrating your victories, big or small, helps keep the momentum going. Every meal, every snack, and every beverage either adds strain or helps relieve it. Consistent, heart-friendly choices restore balance, improve flexibility, stabilize your blood pressure, and increase your energy. Even modest, repeated changes can deliver noticeable improvements in weeks rather than years. Sleep and stress management remain essential because they influence blood pressure independently of what you eat. Pick one single element, hydration, a simple dietary swap, or mindful eating, and commit to doing it consistently. Track your meals, your beverages, and your blood pressure numbers. Review everything at the end of 30 days, celebrate the progress you've made, and then gradually add the next habit. Your heart and arteries have supported you through decades of experiences. Small, steady changes, not drastic or perfect ones, are what give your body the chance to recover, restore its natural flexibility, and stabilize blood pressure effectively. If you've made it all the way to the end of this, please type "Fresh Start" in the comments. Share the one habit you're going to begin with today, and come back after 30 days to let us know how things are going. Your story really could inspire and help someone else who's quietly struggling and wondering why their numbers aren't budging despite their best efforts. Swap white bread, pastries, cakes, cookies, sugary cereals, and sweetened drinks for whole grains like oats, barley, brown rice, whole wheat pasta, fresh or frozen berries, and legumes. When you do eat carbs, pair them with protein or fiber to blunt the blood sugar spike. Harvard data showed that replacing just 2 daily servings of refined carbs with whole grain alternatives reduced systolic pressure by about 6 millimeter Qard over 12 weeks. Handle sodium wisely. Choose fresh whole ingredients whenever possible. Flavor generously with herbs like basil, oregano, thyme, rosemary, spices like turmeric, cumin, paprika, garlic, onion, citrus zest, vinegar, and black pepper instead of relying on bottled sauces, seasoning packets, or heavy salt. The American Heart Association advises most adults over 50, especially those with hypertension, to aim for no more than 1,500 milliliters of sodium daily. Sadly, the average intake in many populations exceeds 3,000 milliliters because of hidden sources. Many people see encouraging signs within days. Week 1 often brings less bloating, slightly reduced ankle or finger swelling, and a growing sense of where the sodium is hiding. By week 2, blood pressure usually starts trending downward, and meals feel more satisfying rather than restrictive. Weeks 3 and 4 frequently deliver clear, measurable progress. Systolic numbers commonly drop 5 to 10 mmHg, and energy improves noticeably. Over months, the benefits compound. Arteries recover some flexibility, the heart pumps more efficiently, and the new habits feel natural rather than effortful. A few essential reminders. This protocol supports, not replaces, medical care. Never discontinue prescribed blood pressure medication or any other drug without your doctor's explicit approval. If you have kidney disease, congestive heart failure, diabetes, or are on a fluid restriction, consult your physician before significantly changing sodium or fluid intake. Change gradually. Pick one step to focus on first so you don't feel overwhelmed. Set up your kitchen for success. Keep cut vegetables, fresh fruit, unsalted nuts, and plain yogurt visible on the counter or at eye level in the fridge. Move chips, cookies, salty snacks, and sugary drinks to less accessible spots. Practice true mindful eating. Eat at a table without television or phone scrolling. Notice flavors, textures, and satisfaction. Stop when you're comfortably full. Hydration supports kidney health, electrolyte balance, and often improves how well medications perform. Brief stress relief matters. 5 minutes of slow, deep breathing or gentle stretching twice a day can measurably lower stress hormones and ease arterial tension. Use a reliable home blood pressure monitor with a validated upper arm cuff and record readings at consistent times. The data will show you which changes produce the biggest benefit for your body. Eating out or attending social events can feel tricky, but preparation helps enormously. Look at menus online beforehand when possible. Request dressings, sauces, and gravies on the side. Choose grilled, baked, or steamed options over fried. Plan a lighter breakfast or lunch if you know dinner will be richer. Involve a spouse, adult child, or close friend. They can offer encouragement and gentle accountability. Regular movement remains vital. Aim for moderate activity you enjoy and can sustain. Brisk walking, water aerobics, chair yoga, light resistance bands, or gardening. Your heart and arteries have supported you through decades of experiences. Small, steady changes, not drastic or perfect ones, are what give your body the chance to recover, restore its natural flexibility, and stabilize blood pressure effectively. If you've made it all the way to the end of this, please type "Fresh Start" in the comments. Share the one habit you're going to begin with today, and come back after 30 days to let us know how things are going. Your story really could inspire and help someone else who's quietly struggling and wondering why their numbers aren't budging despite their best efforts. Progress doesn't come from dramatic, all-or-nothing overhauls. It comes from awareness, consistent daily action, and quiet dedication. I'm Doctor, and I look forward to seeing you in the next video with more practical, evidence-based strategies to help keep your heart and body strong and thriving for years to come.